Hi, my name is Randy Patterson. I'm a psychologist in Vancouver, Canada, and I run a multiple provider private practice called Changeways Clinic. Now, what is this course and who's it for? In brief, the course is about learning to lead a specific cognitive behavior group therapy program for depression and related disorders. And it's designed only for mental health professionals working in registered healthcare professions and students in programs for these professions. Depression is a serious and complex disorder. Psychotherapy is a difficult and complicated practice, and group therapy can be even more complicated. This area is not for amateurs. In order to be helpful, people with depression need caregivers who take their training seriously and who work with caution and professionalism. So, if you're a mental health clinician or are in training to become one, this course may be for you. If not, it isn't. The course is based on a training program I offer in communities across Canada, and I've also taught this program in Australia and Hong Kong. The group program that it's based on has been provided to clients in these areas as well as in New Zealand, the United States, in South America, in China, and elsewhere. It's one of the most widely used depression treatment protocols in the English-speaking world. It was designed at UBC Hospital in Vancouver, and it has been revised multiple times to incorporate new research into the treatment of depression. The protocol is called the CORE program. It's most often used as an 8-session group treatment on an outpatient basis. 2 hours per session, 1 session per week. The program is flexible, however. It can be offered in 6 to 12 sessions or more. It's been used as an open-ended group in private practices, and it's been used as a component of inpatient treatment. Many people who have taken this training have gone on to use the materials and concepts in their work in individual therapy as well. So, who is the protocol designed for? The program was originally designed as a follow-up program after people with major depressive disorder had been discharged from inpatient care. So it was used with a severely depressed population. As it's been adopted by various mental health agencies, it has most often been used on an outpatient basis with people who approach or meet diagnostic criteria for major depressive disorder. It has also been used for people suffering from adjustment disorder, dysthymia, mixed depression and anxiety, and bipolar disorder. In the case of bipolar disorder, it has generally been used primarily as a relapse prevention tool, not as a means of resolving bipolar episodes. The protocol is designed as a set of strategies to help people identify problems in their lives, prioritize them, and work toward their resolution. As such, it can be adapted for many purposes. One agency used it as the core of their support program for the caregivers of dementing family members. Another used it for groups of impoverished single mothers. Others have used it for people without major psychological difficulty, but who are working at getting their lives back on track. Many substance abuse programs have used the program as a later intervention once the abuse itself is under at least some control. So this is a time when many people suffer from mood problems, and becoming aware of the enormity of the task of recreating their lives can be tremendously overwhelming for them. The group can be valuable at this time. Let's take a look at the protocol itself. Accompanying the program is a 91-page workbook-type manual for your clients to use. We give you a PDF of this manual and related worksheets, and permission to reproduce these for your own clients. The manual is divided into 5 main sections, plus a set of introductory pages that explain the format of the book, outline the program contents, and give them the class routines and expectations. Part of this early content is a table of contents that sketches the other 5 sections. Let's take a look at it. The first main section describes the cognitive behavioral model. Why is it that changing our behavior and our thoughts can shift our emotions? And why the emotions themselves, painful as they are, sometimes actually are not disordered. Much of the teaching content for this section parallels ideas from acceptance and commitment therapy, if you're familiar with that model. The first section also introduces the topic of behavioral activation, or as we call it, goal setting. Goal setting is a part of every session of the group. In every meeting, clients identify areas of their life that need work, then boil these down into specific, achievable, SMART goals, and then they report back on these the following week. Clients often find that this is the most powerful aspect of the program. The second section is called Stress, Depression, and Lifestyle. We review the nature and function of the stress response and give a rationale for moderating it. We describe the nature of clinical depression, its many risk factors, its symptoms, the fact that it's very common, and a brief discussion of biological treatments. To give you an idea, we argue that while medication is often helpful for depression, it is not an essential component of treatment for some cases, and it is very seldom a complete treatment. Usually people will need to make other life changes as well. Then we cover the primary lifestyle factors associated with mood disturbance. There are recommendations about diet, physical activity, sleep, caffeine, other drugs and alcohol, and the importance of enjoyable activity. Then, thinking about thinking. This is the largest section of the manual. This is the cognitive therapy material. We cover the rationale of the cognitive approach, and we emphasize the discovery of ways in which distortions in thinking influence a person's mood. Once our clients are aware of these, we provide a series of strategies to overcome these distortions. Now, we're very clear throughout that cognitive therapy is not about positive thinking, because this can be just as distorted as negative thinking. We're after fair and realistic thinking. In this section, we also cover some of the thinking traps that are associated with increases and decreases in mood. For example, sometimes people who have been feeling somewhat better tend to catastrophize whenever their mood dips a little. And when their mood rises, they can tend to overestimate how much they can do, and they forget all about pacing. The fourth section is the role of your social life. This covers building up the social network, developing a support team, and dealing with the changes that take place when we're depressed. As well, a little bit on working with assertive communication. Finally, the road ahead. Strategies on relapse prevention. Once our clients get out of the woods, how can they stay out? So that's the essence of the protocol. It's not revolutionary, nor is it designed to be. It simply incorporates many of the most well-supported strategies for people with mood disorders. As a consumer of continuing education, I'm often put off by the extravagant claims that are made. We can cure people in 2 sessions. This program is good for every mental disorder. This program that we have has been very well received, and it appears to be very effective. But it is not a panacea. It is not intended for every population. For more information about the program, you could visit our website at changeways.com. Now, if you take this course, what do you get? Well, you get the participant manual, which is 91 pages long. You get the clinician's guide, 220 pages. This includes detailed notes on teaching every section of the course, and it includes the quick reference. This is a large format section of cheat sheets that you can use as teaching notes to keep yourself on track as you go through the group with clients. You also get a series of additional handouts, an attendance form, goal-setting forms for you and for the clients, different versions of a cognitive challenging sheet, and feedback forms. And you can reproduce all the client materials for your own clients. We only state that these are for your own clinical use. Now, we supply these materials in 3 formats. For Canada, we have a version in imperial spelling, there's a U in behavior and so on, and it's formatted for standard 8.5 by 11-inch paper. For the United States, we have a version in American spelling, also on 8.5 by 11-inch letter size paper. For all other countries, we have a version in imperial spelling formatted for the taller and narrower A4 paper format. What else do you get? Well, we give you a complete set of PowerPoint handouts in PDF format. You can print these out and follow along as you take the course. There are over 500 slides in total. And we'll give you links so you can get translations of the manual in Farsi, in Arabic, and in Spanish. We'll also give you links to a shorter version of this manual for clients that a colleague and I developed for physicians to give to people recently diagnosed with depression. This is called the Antidepressant Skills Workbook. It's free, and it has translations in Punjabi, French, and Chinese, and a separate version for adolescents. Some centers give these to clients upon first diagnosis and then offer them a space in the group where they can get a more detailed version of the material and the ideas. Now, what if you only see people individually? Or you run groups, but you also want to use this material with your individual clients? One option is simply to give your clients the manual and invite them to work through it between sessions. Another, well, this manual is also a collection of handouts. We've designed it so that new topics generally begin at the top of a new page. So you could print out the individual topics and you'll have a series of information handouts that you can use with clients. As you learn about the core program, I'll give you tips, metaphors, and ideas that you can use in the group and in your individual therapy. Now this is a long course. There are over 50 short lectures totaling well over 12 hours of content. So there's a lot in here. Along the way, I've tried to make it entertaining. You'll hear about experiences that I've had running the group and tips for working with depressed clients. Even if you never run the program as written, I think you'll find some material that will help you with your practice. Still not sure whether you want to register? Well, why not message me and ask me any questions that you might have? Just click on my name under the instructor window. At Changeways Clinic, we've made it our mission to develop and provide evidence-based therapy resources for our own clients and for other professionals to use as well. This course is our flagship. I hope you like it. I hope you find it useful. I'll see you inside.